Welcome to Brain Tumor 101. My name is Mary Lovely, and I am the Senior Advisor at the American Brain Tumor Association. The purpose of this lecture is to provide a general background about brain tumor statistics, tumor types, symptoms, treatments, and effects of brain tumors. Here are some facts about brain tumors. Nearly 70,000 new cases of primary brain tumors will be diagnosed this year. Almost 700,000 people in the world, in the U.S., are living with a brain tumor. And this year, about 14,000 people will lose their battle to a brain tumor. More than 120 types of brain tumors exist. What is a brain tumor? A brain tumor is a collection of abnormal cells. One abnormal cells become two, two become four, four become eight, and they develop into a lump of cells, and they ultimately form a tumor. A tumor can be called a neoplasm, a lesion, or a space-occupying mass. Commonly, a neoplasm is a cancerous tumor. The other abnormalities, a lesion or space-occupying mass, may be a tumor, but it could also be some other neurological disorder. Researchers are still trying to determine what is the cause of the cell's abnormality. It could be multiple insults to the cells, maybe one big hit. They're also looking at a compromised immune system and changes in cells as they age. Also, cell-to-cell communication. There are symptoms related to having a brain tumor, and there are localized symptoms and there are generalized symptoms. The localized symptoms have to do with where the brain tumor is in the brain. So, when we look at this diagram, we see in the frontal lobe lobe's functions are thought, reasoning, behavior, and memory. And in the back part of the frontal lobe is movement. And behind that is sensation in the parietal lobe and the sensory perception areas. The temporal lobe has behavior, memory, hearing, and vision. When we look at the occipital lobe, which is in the back, that is our vision area. The cerebellum is balance and coordination. However, this area also has many connections to the frontal lobe area. The pons and medulla, which is in the brainstem, are relay systems for information coming from the spinal cord up to the brain, and vice versa, brain information going down to the spinal cord. It also includes all of our cranial nerves, which is our eye movements, our face movements, and sensation. The generalized symptoms include unusual headaches or generalized headaches, seizures, which can be just a quick involuntary movement. It can be also blanking out look where you don't lose consciousness, or it can be the generalized tonic-clonic seizure where somebody falls on the floor and becomes unconscious. Memory, personality, and behavioral changes are very common, and it's not surprising that the first person who notices this is the caregiver or the loved one. There's also an inability to process incoming information correctly. And sometimes people have visual changes such as blurred vision and double vision. They may have change in walking and commonly changes in fatigue. And the fatigue makes all the other symptoms worse. Brain tumors are usually diagnosed with an MRI. MRI is given with a contrast dye, and it is the gold standard for diagnosis. Now, if a person is taken to the emergency room for neurological symptoms, a CT scan is commonly the first test done. If a brain tumor is suspected from the results of the CT scan, usually the doctor will then order an MRI. Tissue samples of the brain tumor are the most reliable method of diagnosis. The pathologist is able to examine the cells under a microscope, and the doctor may perform other tests that will provide data about the genomic makeup of the tumor. Researchers are looking for ways to define characteristics of the tumor through biomarkers in the tissue, blood, and other bodily fluids. There are two broad categories of brain tumors: the primary brain tumors and the metastatic brain tumors. Primary brain tumors begin in the brain and tend to stay in the brain. And as we previously heard, that nearly 70,000 brain tumors are diagnosed annually, and 4,600 of these are children. A metastatic brain tumor begins as a cancer somewhere else in the body, and it goes to the brain. There's about 55,000 people diagnosed with metastatic brain tumors annually. This is an imaging of a primary and metastatic brain tumor. The primary brain tumor is on the left. It's usually single, and it has this characteristic of one tumor, whereas metastatic tumors often are multiples, and it has a characteristic of circumscribed little tumors. Metastatic brain tumors are known from the site that they come from. So commonly people will say the person has a brain tumor metastasized from the lung, or a brain tumor metastasized from the breast, or a main tumor metastasized from melanoma. About a third of the people with metastatic tumors will have a single tumor or lesion, and 2/3 will have multiples. The treatment is focused at the tumors, but now also chemo. If there's a specific chemo for that type of a primary tumor, they'll try. Patients commonly receive treatment in their community, and so they return to their primary site care team. So if the primary site care team is their lung oncologist, that's who usually takes care of the metastatic brain tumor as well. Primary tumors start in the brain. The type of tumor is determined by what the cells look like under the microscope. For example, the tumor is identified as glioblastoma or meningioma or oligodendroglioma. The classification is based upon the biology of the tumor when we're talking about tumor biology, such as EGFR or MGMT and IDH1 mutations. We are lucky enough to have a wonderful brain tumor registry, the Central Brain Tumor Registry, that tracks the incidence of tumors. The most common tumor types are meningioma and glioma of the primary tumors. Glioma includes low-grade astrocytoma, malignant astrocytoma, oligodendroglioma, and glioblastoma. Now, the more common pediatric tumor types include medulloblastoma, ependymoma, and pilocytic astrocytoma. Meningioma is the most common type of primary tumor. As you can see in this picture, it comes from the covering of the brain, and we all have the covering of the brain right around here and right around here. And so this tumor, this white area here, comes from the covering of the brain and pushes into the brain. And on this side we see another meningioma. This is a picture of another meningioma where it is pushing on the brain, and it comes from the covering of the brain. So this is a good illustration of a meningioma. The malignant glioma arise from the glial cells or the gluey supportive cells. There are different types of gliomas, as we've discussed: astrocytoma, oligodendroglioma, glioblastoma. This is a picture of an anaplastic astrocytoma before treatment. This is a picture of a glioblastoma before treatment. A question comes up: what is benign versus malignant? Benign tumors are considered non-cancerous. They are slow growing. Even if a tumor is benign, the tumor can affect function depending on its location. A malignant tumor is faster growing and invades the brain, and it also can affect function. Brain tumors do not discriminate between people of color or of socioeconomic status and have only a little difference between male and females. Younger adults have more low-grade tumors, and older adults will have more malignant gliomas. In this slide, you can see that gliomas do still remain the highest type of tumor for pediatrics, but medulloblastoma, which is common in children, is the green line. And also still pilocytic astrocytoma is high in children as well. Now this slide is supposed to say 20 to 74 years. And when we see this, this is for the older group, adults. When you see this slide, you see the green line is meningioma. So it's rare for a meningioma to have in the younger years, but they do become more common as we get older. And glioblastoma is the next higher type of tumor that increases with age. So the other types of tumors, astrocytoma, with oligodendroglioma, and all of these are just kind of do not have as much of an age difference, but it's the meningioma and the glioblastoma that increase with age. The most common treatment for brain tumors includes surgery, radiation therapy, and chemotherapy. Surgery is used to remove as much of the tumor as possible without causing neurological harm. Radiation is used to disable cell reproduction and shrink the tumor. And chemotherapy is used to kill tumor cells or interfere with their growth. Now, depending on the type of tumor and the location and how the patient is doing, it will depend on if they have the surgery, the radiation, or the chemotherapy. In some cases, a person will not have surgery, or a doctor will wait to see how the tumor is growing, or if the tumor is growing. So sometimes there will be no treatment, but these are the common types of treatments. What are new treatments that are coming? There are many neurosurgical techniques that are being updated to give the neurosurgeon better visibility to remove as much tumor as possible. And we do know that extent of tumor removal is a big factor in survival. The new treatments are headed with radiation. The better imaging during surgery leads to greater visibility. Radiation oncologists have been experimenting with different types of radiation and radiation enhancers. And neuro-oncologists are working with targeted drug therapies and drugs used for other purposes to be tried for brain tumors. They have also been using alternating electrical fields that disrupt cell growth, new immune-enhancing drugs as well. Researchers are challenged with identifying tumor stages through blood and other fields. We are in a very active and exciting research time. Prognosis is the prediction of how long someone may live with a tumor. In the case of benign tumors, prognosis is based on how much the tumor is removed. The more tumor that is removed, the better prognosis. A person may live a long time with a benign tumor, But if it is located in an area that controls speech, vision, movement, or memory, it can impact their life, especially their quality of life. For malignant brain tumors, poorer survival is associated with greater age than 45. The amount of tumor removed, and the tumor type, such as glioblastoma. Not all tumor types of the same tumors of the same type will have the same survival because there are so many factors involved. It could be general health, comorbidities, location, and we do know that even the same type of tumor may have a different genomic makeup. Now, these types of tumors definitely have effects on patients. Now, for patients with malignant tumors, there can be neurocognition problems, slower processing, poor attention, short-term memory, and lack of abstract thinking. There's commonly changes in personality and ethical judgment. Fatigue, as an initial symptom, usually remains, and it makes the other symptoms worse. They may have headaches and some visual changes. Even on benign patients, they have problems. Many benign patients get this from their families, but you look fine to me. Even though after a tumor removal, they may have neurological problems. They may have fatigue, math, reading challenges, depending on the location of the tumor and how much and the extent of how much was removed. They could have short-term memory issues, employment and job-related challenges, balance, walking challenges, and personality changes, just like people with malignant tumors. So while you may live a long time, you may still have some issues. This also has effects on the family, because if somebody is not able to do what they did before, or they're not exactly the same person they were before, there's a loss of relationships as they once existed. There's a change in traditional roles. Single parenting may be occurring in a two-parent household. And fear of seizures, fear of personality behaviors, fear of the unknown, fear of the future. And we know that caregivers need help, and they need their support as well. So it's a family disease, and we understand this. And that's why we're here to help and connect with other people. So if you have questions about brain tumors and you would like to learn more about how we can help you at the American Brain Tumor Association, please call us at 800-886-2282. That's our care line. Our email is abtacares@abta.org, or please go online, abta.org. We're here to help you. We have licensed professionals that can help sort out issues. Thank you very much.